Hey everyone, my name is Audra Canoy, and this is my presentation for my case study for NFS 774. So, the primary diagnosis for my patient was diastolic congestive heart failure. On 12/31, the patient, an 83-year-old female, presented to Baptist with shortness of breath. On arrival at the hospital, a chest x-ray was completed, showing worsening moderate severity infiltrates with bibasilar predominance and a small bilateral pleural effusions. Bibasilar atelectasis in pleural effusions can be a result of congestive heart failure. She underwent mitral valve and aortic valve surgery on January 10th. Her pacemaker was placed on January 17th for bradycardia. She was admitted to Methodist Rehabilitation Center, which is where I met her, due to functioning deficits that required longer rehabilitation. Congestive heart failure is a condition in which the heart does not pump blood as effectively as it should. It means that the heart is not working as well as it should be and can no longer keep up with the demands of the body. Because of this, not enough oxygenated blood is getting to the body's other organs. The body will try to make up for this decrease in function by beating faster, which can cause heart palpitations. The heart can also increase in size, which will cause fluid buildup on the lungs, which will then lead to shortness of breath. These are the symptoms that JT was experiencing. Heart failure cannot be cured and will progressively worsen even with proper treatment. The main nutritional concerns with CHF is sodium and fluid intake. If the patient eats too much salt or drinks too much fluid, the body's water content may increase and make your heart work harder. This can exacerbate CHF. Her comorbidities include chronic kidney disease stage 3, chronic obstructive pulmonary disease, type 2 diabetes, essential hypertension, folate deficiency, iron deficiency anemia, idiopathic anemia, mixed hyperlipidemia, osteoporosis, vitamin B12 deficiency, and vitamin D deficiency. Um, According to the Mayo Clinic, type 2 diabetes is the result of two interrelated problems. First, the cells in your muscles, fat, and liver become resistant to insulin, and because of this, they don't take in enough sugar. Secondly, the pancreas is unable to produce enough insulin to manage blood sugar levels. Type 2 diabetes affects many major organs, including the heart, blood vessel, nerves, eyes, and kidneys. The main nutritional concerns in type 2 diabetes is eating well enough to keep blood sugar, blood pressure, and cholesterol levels under control. Dietary changes with type 2 diabetes are usually focused on eating nutritious foods and getting to and maintaining a healthy weight. If you take insulin, it is also important to be consistent about what you eat and when. JT's chronic kidney disease is a result of her type 2 diabetes. This can happen because over time, high blood glucose from diabetes can damage blood vessels in the kidneys as well as nephrons, which are the tiny filters located in the kidney, so that they don't work as well as they should. JT also has hypertension, which puts strain and damages on the kidneys along with diabetes. Since JT is not currently on dialysis, the main nutrition concern for her CKD is reducing protein so that there is no extra strain placed on her kidneys. It is important to balance this because eating too little protein can also lead to malnutrition. COPD, or chronic obstructive pulmonary disease, is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. It can be caused by long-term exposure to irritating gases, usually cigarette smoke. JT used to smoke 1 pack of cigarettes a day, which likely contributed to her development of COPD. For people with COPD, it is beneficial to eat a diet with fewer carbohydrates and more fat so that they can breathe easier. This is because metabolism of carbs produces the most carbon dioxide for the amount of oxygen used. Metabolism of fat, however, produces the least. Essential hypertension occurs when the body has abnormally high blood pressure that is not the result of a medical condition. This is often due to obesity, family history, and an unhealthy diet. High blood pressure occurs when the walls of the arteries exert a stronger oppositional force, which results in the heart having to work harder to pump blood through the body. Essential hypertension can lead to a heart attack and heart failure. Iron deficiency anemia is a condition in which blood lacks adequate healthy red blood cells. Without enough iron, the body can't produce enough hemoglobin and red blood cells that enables them to carry oxygen. This can be corrected with iron supplementation. Vitamin B12 deficiency anemia is a condition in which the body does not have enough healthy red blood cells. Symptoms of this include fatigue, breathlessness, numbness, poor balance, and memory trouble. Treatments include dietary changes, B12 shots, or supplements. Vitamin D deficiency can lead to a loss of bone density. Adults older than 65 have a higher risk of developing vitamin D deficiency. It can lead to thin, brittle, or misshapen bones. Supplementation is the main treatment. Folic acid is a type of B vitamin. When there isn't enough, it can result in an insufficient number of healthy red blood cells. Symptoms include fatigue and mouth sores. Treatments for folate deficiency include vitamin supplements and a vitamin-rich diet. So JT is an 83-year-old female. She reported good intake and appetite of meals at the center and stated that her son was bringing her a protein shake every other day. Her diet order is heart healthy with 60-60-60 consistent carbohydrate modification. When discussing food with JT, she stated that the food was tasteless and didn't have enough spices on it. I did have a discussion with her that her diet is heart healthy, and I explained what that meant to her, that her food has limited amounts of salt included in it so that it can help with controlling her blood pressure. She voiced understanding, and I recommended seasoning her foods with garlic, lemon, black pepper, or onion instead of salt. Her medications, Humalog is used with a proper diet and exercise program to control high blood sugar in people with diabetes. Glucophage or metformin is used with a proper diet and exercise program and with other medications to control high blood sugar. It is used in patients with type 2 diabetes. It works by helping restore the body's proper response to the insulin you naturally produce. It also decreases the amount of sugar that your liver makes and that your stomach and intestines absorb. Lasix is used to reduce extra fluid in the body caused by conditions such as heart failure, liver disease, and kidney disease. This can lessen symptoms such as shortness of breath and swelling in your arms, legs, and abdomen. It can also be used to treat high blood pressure. It is a water pill or diuretic that causes you to make more urine. This helps your body get rid of extra water and salt. Lipitor is used along with a proper diet to help lower bad cholesterol and fats such as LDL and triglycerides and help raise the good cholesterol such as HDL in the blood. It belongs to a group of drugs known as statins. It works by reducing the amount of cholesterol made by the liver. Doing this decreases the risk of heart disease and helps prevent strokes and heart attacks. Vitamin D3 is a fat-soluble vitamin that helps your body absorb calcium and phosphorus. It is used to treat and prevent bone disorders. Vitamin D with calcium is used to treat or prevent bone loss. It is also used with other medications to treat low levels of calcium or phosphate caused by certain disorders. Norvasc is used with or without other medications to treat high blood pressure. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. It belongs to a class of drugs known as calcium channel blockers. It works by relaxing blood vessels so blood can flow more easily. It is also used to prevent certain types of chest pains. It may help to increase your ability to exercise and decrease the frequency of chest pain. Her nutrition-related ADLs, she is able to eat on her own, but will be having help from her son and a home health nurse to cook and prepare food. She needs assistance with setup or cleanup of meals and needs assistance walking. She is mostly wheelchair bound. JT's levels of BUN and GFR are abnormal as a result of the diagnosis of chronic kidney disease, stage 3. Her blood glucose and A1C were abnormal because of her poorly controlled type 2 diabetes. JT's hemoglobin and hematocrit levels are low as a result of her anemia diagnosis. Nutrition-focused physical exam. She was well-developed and did not show signs of muscle wasting. She's a single Caucasian female, lives alone, is retired. She has a family history of hypertension, heart disease, and stroke. She will be continuing outpatient physical/occupational therapy through Methodist Rehab. She was a former smoker, 1 pack a day for 16 years, currently uses alcohol a few times a week. Her estimated energy needs were about 1498 kilocalories, used her adjusted body weight and 25 kilocalories per kilogram. Her estimated protein needs were 59.9 grams, using adjusted body weight and 1.0 grams per kilogram. Her estimated fluid needs were 1498 milliliters, using adjusted body weight and 25 milliliters per kilogram. Her recommended body weight is 115 pounds, ideal body weight. Her current and actual body weight is 171 pounds. She is meeting energy needs by eating 75 to 100% of meals, along with the protein shake that her son is bringing. Her altered nutrition-related laboratory values. The diagnosis is altered nutrition-related laboratory values related to type 2 diabetes, as evidenced by a patient having an A1C of 6.4 and elevated blood glucose. Excessive fluid intake related to congestive heart failure, as evidenced by edema in the skin of the legs. Overweight and obesity due to excess energy intake, as evidenced by a BMI of 30.3. So, interventions. She was originally on Heart Healthy Diet upon admission. After meeting with her, I updated her diet to include carbohydrate restrictions as well to help manage blood glucose levels because her levels had been trending high. I did discuss low sodium diet with her after her complaints of food being tasteless. I talked to her about her diet order. I explained what it meant and why it was the way that it was. Recommended using herbs and spices to flavor foods rather than salt. She voiced understanding and even came up with some of her own ideas about what to use rather than salt. According to the Nutrition Care Manual, the initial goal of nutrition therapy for heart failure is to manage symptoms of fluid retention, shortness of breath, and fatigue. A longer-term goal is to reduce the heart's workload, providing for a longer life and better quality of life. Sodium, less than 2 grams per day for patients with moderate to severe heart failure. Fluid restriction to less than 2 liters per day for patients with serum sodium below 130. This serum sodium value indicates fluid retention that is difficult to control despite high doses of diuretic and sodium restriction. Another recommendation is thiamine and potassium supplementation as needed to compensate for losses in patients on diuretics. Recommendations for diabetes. Nutrition therapy take into account 2 factors. The nutrition therapy should be evidence-based, and the nutrition prescription should be individualized and determined in collaboration with the patient or client. Overweight and obese individuals with diabetes, particularly those with newly diagnosed diabetes, will experience clinical benefits in glycemia, blood pressure, and or lipid levels following weight loss of 5 to 10%. Due to a wide variation in study design, there is no consistent definition of low carbohydrate, but it can be defined as reducing carbohydrates to 26% to 45% of total energy. A variety of eating plans incorporate carbohydrate reduction to meet individualized preferences. The dietary approaches to stop hypertension eating plan results in weight loss and lower blood pressure, but it would not result in significant glycemic reduction. Following a Mediterranean-style eating plan results in the reduction of A1C and triglycerides and risk of major cardiovascular events in this population. The nutrition therapy recommended for adult patients with overweight and obesity should meet the DRIs for essential nutrients, depending on vitamin D prescription. Supplementation with vitamin D is warranted given high incidence of deficiency in people with obesity. Although the Mediterranean diet has been a focus of research in cardiovascular health, it can be used for weight management. There is a potential benefit of over other eating patterns for reduction of central adiposity with energy restriction. There is inadequate evidence for advising that a Mediterranean diet has advantage over other energy restriction methods for weight loss, despite the focus on heart-healthy foods. In adults with chronic kidney disease in stages 1 through 5D, the RD, often in collaboration with other healthcare providers, provides individualized MNT to optimize nutritional status and minimize risks imposed by comorbidities and alterations in metabolism on the progression of kidney disease and on adverse clinical outcomes. Mediterranean dietary pattern in adults with CKD, not on dialysis, with or without dyslipidemia, may improve lipid profiles. Increased fruit and vegetable intake may decrease body weight, blood pressure, and net acid production. For patients with diabetes, dietary protein intake of 0.6 to 0.8 grams per kilogram body weight per day. A short-term goal that we identified with her was to reduce her sodium in diet. Long-term goal was to lower her A1C and reduce blood pressure. Monitoring and evaluation. I continued to follow up with her weekly until the end of stay. She would benefit from meeting with a dietitian in an outpatient setting due to her complex dietary restrictions with CHF, hypertension, type 2 diabetes, and chronic kidney disease. She will continue to meet at MRC for the next several weeks in an outpatient setting. And so the dietitian at MRC could be able to continue following up with her through that appointment. And these are my references.